So this lecture will be a introduction to the skeletal system, and then we'll have kind of separate brief episodes where I'll just go over the different parts of the skeleton, just mainly to pronounce the bones to you and kind of point out unique features of the bones. And that stuff will kind of be the things that you have to memorize, especially for your practicals for lab. But the majority of this lecture will be the stuff that you'll see more on your multiple choice test, for example. And we're just going to go over kind of the features of bone, from the microscopic and to the histology to actual gross anatomy of bones. So this will be kind of an introductory lecture to all that. So to start, I wanted to open with a case study of Edna. And you can see Edna's lumbar spine x-ray. That's a lateral view there on the right. And Edna is a 72-year-old female. So she's a bit older, and she's been complaining of pain in her lower back for the last 3 days. She didn't have any trauma, meaning she wasn't hit in the back or didn't fall on the back or wasn't in a car accident or anything like that. But she has been having a cold for the last week or so, and has been doing a lot of coughing and sneezing. On the exam, when you examine her, when you press over her lower back right in the middle, right where the vertebrae are, you notice that she's tender in the lower back. So keep that in mind. We're actually going to come back to Edna kind of midway through the lecture and see if we can figure out what's going on with her. So let's begin with the introduction of the skeletal system. We call it a system instead of just saying, hey, we're doing bones. There's a little bit more to it than bones. Bones are certainly part of this system, probably the main part of the system, and most of what you're going to learn will be about the bones. But there's also cartilages that are part of the skeletal system, ligaments which hold bones together. They hold one bone to another bone, or sometimes they hold a bone to a cartilage. And then there's other stabilizing connective tissues. For example, the discs in between the vertebrae, the intervertebral discs, that are also part of this system. There are lots of functions of the skeletal system. I think some of them we think about readily, and other ones maybe you've never thought about before. So the bones and the cartilages and the ligaments, they of course give us support or give our body a framework. They make you. I mean, it's what your skin hangs on, right? It's what your muscles attach to. So it's the framework for your body. Protection you've probably thought about before. For example, your heart and your lungs are encased in your thoracic cavity, in your thorax, and that protects those organs from being injured. If you're a female, for example, your uterus and your ovaries are in that pelvic girdle, kind of tucked down into the pelvis, surrounded by all those pelvic bones, which is great protection for that very important organ. But there's other things like leverage, for example. One of the reason that we are able to lift heavier objects is because of the length of our bones. So we'll talk about this a little bit when we get to looking at muscles. But basically our body functions as a bunch of levers or levers. So in order to lift something, the longer the lever, the easier it is to lift. And so that's one of the reasons why, for example, our arms are not short and stubby, but our arms are long and hang at our side. Having longer arms and having longer legs allows us to move larger loads, to lift heavier objects. And that's one of the functions of the skeletal system. Your bones are also a major storage center for minerals like calcium and other substances like phosphate, for example. So calcium and phosphate are stored in the bone. And your blood cells are also produced in your long bones, in the marrow of your long bones. That's where your blood cells are made. So these may be some of the functions that you haven't thought about before. So I want to take a look down microscopic. If we took a piece of bone and we looked under the microscope, and we may have a chance to do this in lab, to look at some samples of bone. what would you see? I mean, what does bone look like histologically as a tissue, or even microscopically down to the cellular level? Well, what we would find primarily are what we call osteocytes. Remember, we talked in class that this term site means cell. And you're going to see here then that osteo, I'm going to change this pen real quick, that osteo then means, is going to be the root word for bone, right? So osteocytes are the cells which make up bone. So these are what we would call mature bone cells, meaning these are the ones that are done developing, and their job at this point is really to kind of help regulate calcium metabolism, help keep the calcium levels where they're supposed to be. So they're going to respond to some hormones that we'll talk about later and help regulate calcium metabolism. Now you can imagine if you've got bone being as hard as it is, that you can't just have living cells in the middle of that hard mineralized bone. You've got to kind of have safe places for them, or homes for these living cells to thrive in. And those holes, or those homes, are called lacunae. And I think we've seen this word before when we were looking at tissue types. Both cartilage and bone have lacunae, and the osteocytes are going to be living in there. So if you look on the picture over here, all these little holes that you see, these are all lacunae. So inside those little holes, that's where you would find these living cells, these mature bone cells called osteocytes. So in between these lacunae, there's bone, right? So like in between this one and this one, there's a bunch of bone, and in between this one and this one, there's a bunch of bone. So, or let's say this one and this one, you can see there's a bunch of bone. So those areas of bone in between the lacunae we call lamellae. And we'll have another slide here in a few minutes that gives us different types of lamellae. And you can also imagine there's kind of a unique challenge in bone for one osteocyte to communicate with another osteocyte. Because there's distance in between the cells, and because the material in between the cells is mineralized, is very hard, they need a special way of communicating with each other. And so those special channels through which they communicate are called canaliculi. And so if you look down at the picture there, here's one osteocyte and here's another osteocyte, and there may be, lamellae in between, and they're going to communicate by sending out these feet almost, or these arms, called canaliculi, and that's how they're going to communicate with each other. So you can see lamellae, you can see lacunae. We're going to call this whole unit that you can see here, centered around a central canal, we're going to call that an osteon. We're going to see this here on a slide coming up soon. Okay, so if we keep looking microscopically at bone tissue, we will find osteocytes, which are mature bone cells, but we will also find osteoblasts. So again, you see that root word osteo, meaning bone, and we come up with a new word, blasts. This term blast, B-L-A-S-T, is used frequently in anatomy to describe cells in multiple tissues that are responsible for creating new tissue. So, for example, when we get to the blood chapter, we're going to find that there are blasts there, and those are going to be kind of immature blood cells. They're going to become the cells that will become more blood cells in the future. And so osteoblasts you can kind of think of as being almost immature bone cells, and they are responsible for creating more bone, more matrix. And so they do that by secreting something called osteoid, you see here. And that osteoid is kind of the liquid matrix that bone is initially made out of. Now that liquid matrix, that osteoid, will eventually become mineralized and become hardened like the rest of bone. But that's how the bone is going to grow from this osteoid being produced and released by the osteoblasts, eventually that's going to create new bone. Now, osteoblasts will eventually become osteocytes, and then their function will change. But so long as they remain osteoblasts, they will continue to create new bone. When we talk about the creation of new bone, we're going to call that osteogenesis. So you see osteo again, that's that root word of bone. And genesis, you can think of the first book of the Bible. The first words of that book are in the beginning, right? It's a book about the creation of the world and the creation of a particular family. So Genesis means creation, or beginning is probably a better word for Genesis. So we're talking about the beginning of bone, or the creation of new bone. So osteogenesis is made possible by osteoblasts as they secrete osteoid, which eventually becomes calcified bone matrix. Another cell that you would find if you looked deep under a microscope and you looked for different cells in there. So we had osteocytes, were mature bone cells. Osteoblasts were responsible for laying down new bone. And osteoclasts are responsible for breaking down bone. So they're kind of the yang to the yin of osteoblasts. So if all you had were osteoblasts, then bone would just grow and grow and grow and grow, and we would get bigger and bigger and bigger for the rest of our lives. So you need to have something to balance those osteoblasts, and that's where the osteoclasts come in. So for most of us, I mean, most of you guys are done growing, and for sure I'm done growing. At least my skeleton is done growing. And so for someone like me, let's say a middle-aged adult, my osteoblastic activity is completely equaled by osteoclastic activity, so that I don't have any new bone growth, and I'm also not losing bone density. My bone density is going to stay pretty much the same until I get much older. And so my osteoclasts are breaking down bone at the same rate as my osteoblasts are creating new bone. Another unique kind of characteristic of these osteoclasts is that they are multinucleated. We're only going to find a few cells in the human body that have more than one nucleus, and so osteoclasts are one of those. So just like we talked about osteoblasts and making new bone, so we said osteoblasts created new bone, and we call that osteogenesis, right? So here we're going to have osteoclasts. They're going to break down, and that's going to be osteolysis. And of course, they're going to be in balance. So let's say when you're an infant and you're actually growing at the fastest rate that you're going to grow in your whole life is during the first 6 months of life. And then again, you're going to have another rapid growth during puberty, right? During your adolescent years. During those years of rapid growth, osteoblastic activity is greater than osteoclastic activity, right? So you're actually laying down more bone than you are reabsorbing, so you're getting new bone growth, and you're actually getting longer in your bones, and you're getting wider in your bones. Once puberty stops and you kind of reach your growth at age 21 for most people, even up to age 25. That's why I said some of you may still have some growth to do. But once you reach that 21 to 25 age, osteoblastic and osteoclastic activity equal each other, and we stop really growing. Our bones stop growing. All right, I also mentioned back in the tissue chapter, if you remember, that every tissue that we look at is going to have stem cells, and those stem cells are necessary to make new cells, right? Cells are always dying, and if we didn't have a way of replacing those dead cells, then eventually the tissue would die out altogether as the cells died one by one. So we need stem cells in order to create new cells of that type of tissue. So here in the bone, the stem cells are called osteoprogenitor cells. So there's that osteo again. And these are the stem cells particular to bone tissue. And they are found really in only two places. So new cells and therefore bone growth really only occur in two places in bone. They occur from the outside. So let's say we have a long bone. Let me draw something here. Maybe this is like a humerus or a femur. Let's say this is a femur, and that's the head and that's the neck, and here's the bone. So around the outside of the bone, you have a layer of a membrane called the periosteum. Peri meaning surrounding and osteum meaning bone. And then if we kind of cut through that bone and looked on the side, we would see that there's kind of a circle within a circle, and that inner circle is also surrounded by a layer of cells called the endosteum. So growth can only occur from the outside or from the inside, but not from the middle, because this is where those osteoprogenitor cells live. And these are needed to repair bone. So they're important in fracture, but they're also important in just replacing bone cells that die. Okay, there's in general two types of bone. Now we're gonna find a whole bunch of bones, kind of named by their shape, but in general there's two types of bone by composition. So some bone is really kind of tightly packed together, and we would call that compact bone. And then there's a different kind of bone that's more like a meshwork, almost more like a net of bone, and we will call that spongy bone, and we'll see some examples here of both. So compact bone is the really tight, kind of really strong bone, and it's what the outside of most of our long bones are made out of is compact bone. I mean, most of the outside of all of our bones really are made of compact bone. So if we're looking at this picture of a long bone, this looks like the humerus, yeah. The compact bone is going to be basically from here to here and from here to here, all the way around that bone. And the benefit of compact bone is that it's really, really strong, kind of in the axis of its growth. So if you're looking at this humerus here, and you see that the humerus is kind of in this axis, right? Kind of this up and down long axis. And so any pressure that's put on the bone this way or put on the bone this way really is going to be difficult to hurt the bone, to break the bone, because you have so much strength going in this direction because of that compact bone. Where a lot of bones are broken is when they experience a force coming from this direction, kind of perpendicular or at an angle to that compact bone, because you don't have as much strength coming from a different direction. You only get your strength in compact bone from the direction that that compact bone is laid down, which in the case of this humerus is in this kind of up and down position. So if you take a force, if somebody kind of tackles you, for example, from the side and crushes your bone coming in from the side, you are actually quite a bit more susceptible to a fracture at that angle than you would if somebody came down from the top of your shoulder and pushed down on your humerus. Spongy bone is often on the inside of the bone and often surrounds the bone marrow. So this would be kind of the spongy part. And what's helpful about spongy bone is that it kind of, we'll see in another picture, it kind of sends out, little bits of bone in all directions. So that gives you more support from multiple directions. This is what was lacking with the compact bone, right? You had great support along one axis, but really poor support if you came at an angle to that axis. Well, spongy bone is kind of going out in all directions, so you get support really in all directions. Now, that support is not as strong as the support from the contact bone or compact bone, but it is support in multiple directions. The other benefit of spongy bone is it's lightweight. Because it's not tightly packed but has space in between, that makes it lighter. And this is important. If our bodies were completely composed of compact bone, which would give us maybe more strength, we would be really heavy. We would weigh a lot more than we weigh now, and this would put a lot of extra strain on your muscles to keep you standing upright, to help you walk, to raise your arm, to lift your head. If we didn't have spongy bone, everything would be much heavier, and you would have to exert a lot more energy in order to just move around. So you can see how both of these are really necessary for the human body. Okay, so compact bone, that's kind of what we looked at when I was showing you the osteocytes and the lamellae and the on that picture a few slides ago. That was really a good picture of compact bone. So if we look at, so we're going to take a look separately. This is the spongy bone here. We're going to take a look separately at the spongy bone on another slide. But if we look here on the rest of this sample here at the compact bone, we can see that there's kind of a very particular structure here. And a lot of it has to do with allowing communication between cells or allowing arteries and veins to be able to move through the bone because the bone is so compact. It has to be structured around these particular structures, which we're going to call osteons. So an osteon is the functional unit. You can see there is the functional unit of bone, meaning that all the necessary parts can be found in one osteon. And so what are those necessary parts? Well, you have to have a canal, a central canal for blood vessels to run through so that it can be nourished. You have to have lacunae, you have to have lamellae so that the osteocytes have a place to stay. And in compact bone, we're going to find there are actually three types of lamellae. Remember, lamellae was the matrix of bone in between the lacunae where the osteocytes lived. So in compact bone, there's actually three types of lamellae. There's concentric, which would be kind of represented there. You can see how there's like concentric circles, right, inside that osteon. And so the concentric, maybe if we blow it up, here we go. There's a good picture there showing you. That's the concentric lamellae. Then there's interstitial lamellae. That's the lamellae in between the osteons. So this would be interstitial, for example. This would be interstitial. This would be interstitial. And then you've got lamellae going all around the outside of the bone, and that's the circumferential lamella you can see here. So that's all of this going all the way around the bone. Spongy bone, as I mentioned, is usually on the inside of the bone, surrounding the marrow. And it's a lot more mesh-like, as you can see in the picture there, more like a net with sending out trabeculae in all directions. And I think this picture helps us see what we're talking about. This is kind of a cross-section, this is a coronal section of this long bone. Looks like a femur. And you can see the compact bone out here. And you can see compact bone here, right, all the way around. But then you also kind of see this wispy-looking bone, right? Kind of airy-looking bone. That's the spongy bone. And it continues all the way down there. And that spongy bone, as we mentioned, was going to be more lightweight, which is important, and will also give some support from multiple directions. And you can see there's also lamellae in there. Okay, if we just take a long bone, and we're going to learn later that the names of the long bones, but basically your arms and legs contain your long bones. And each of those bones has several identifiable parts. And so we're just going to look at a kind of a generic long bone, and it's going to be applicable to really all of those bones of the arms and legs that we'll talk about here in a little while. So each long bone is going to have two epiphyses. So the epiphyses you can think of as being end. I'm not sure if we mentioned this earlier, but epi comes from the Greek word that means basically above or kind of around the outside. And so when you see epi in anatomy, it usually means something that's on the end or on the outside. And so in this case, the epiphyses are going to be basically the two ends of the bone. So you can see you have an epiphysis from here to here, and you have an epiphysis from here to here. So the top of the bone and the bottom of the bone we're going to call the epiphysis. Another way to think of it is that it's above the growth plate. So the growth plate is what we're going to call the physis. So this term that we're seeing, epiphysis, metaphysis, and diaphysis. You keep seeing this word physis, physis, physis. You see that? Physis, physis. So physis really means growth plate. So we call the part of the bone that surrounds the growth plate, we call that the metaphysis. That also comes from Greek. But it just means basically the area of the growth plate, or the area right next to the growth plate. And so you're going to have two metaphyses, one on the proximal end of the bone and one on the distal end of the bone. That's going to be the metaphysis. And then you're going to have one diaphysis. So all of the bone in between the two metaphyses is going to be called the diaphysis. So two epiphyses, two metaphyses, and one diaphysis. And then the last part of every long bone are articular surfaces, because these bones are going to articulate or form a joint with another bone. All of the long bones do that. So in this case, we're looking at, I would guess this is a femur. So this is going to be the articular surface that goes into the hip, and this is going to be the articular surface that goes into the tibia. So there's going to be articular surfaces in addition to the epiphysis, metaphysis, and diaphysis. Okay, I already mentioned this a little bit previously, but there are kind of two linings to bones. There's the periosteum. Peri means kind of around, so that's going to be around the outside of the bone. And then endo means inside, so that's how you're going to know the difference between periosteum goes around the outside and endosteum kind of lines the inside of the bone. The endosteum does have some role in bone growth and remodeling. But the periosteum is probably something that you're going to hear mentioned more commonly. It lines every bone and kind of separates it from the surrounding tissue, whether that's muscle or some kind of subcutaneous tissue. The periosteum is going to kind of separate the bone from surrounding tissue. It also forms a surface through to which blood vessels that are needed to basically nourish the bone can attach to. So it becomes something. It's hard to attach to bone because bone is so hard. So these structures like nerves, arteries, and veins are going to be able to run alongside, attached to the periosteum. It's also involved in bone growth and repair like the endosteum, and it's also what's going to attach the bone to the fascia, which is kind of the lining of the muscle. So it has something to do with the attachment of bone to muscle. Tendons, for example, are the ends of muscles, and they are what attach the muscle to the bone. And what you can see, I love this picture because it does a great job of helping us see if this is the bone. This is a bone here, and this is the periosteum, which is the lining of the bone, the outside lining, right? And here comes a muscle. Let's say there's a muscle over here, and the end of that muscle is a tendon, and that tendon has to connect this muscle to this bone, right? So the way that it does that is it actually inserts itself right into the periosteum. I mean, how cool is that? That's how much stronger of an attachment could you get than just attaching yourself right into the tissue structure surrounding the bone? And so we can see the periosteum is important for joints and for tendons as well. We'll see a picture later of how the periosteum becomes continuous with the joint as well at the ends of bones. Okay, we talked about osteogenesis a little bit earlier, and that was kind of the creation of new bone by osteoblasts, if you remember that. It was the secretion of osteoid, and then that osteoid gets mineralized and becomes hard and becomes new bone. So that's different from this term, which is called ossification. So ossification means to take a tissue that is not bone and to turn it into bone. So most of the time we're talking about taking cartilage and turning it into bone. So babies, for example, when you are first born, you have a ton of cartilage that needs to eventually be turned into bone in order for you to have more support and more of a structure. Babies are super flexible because of their cartilage, and this is great for when they're trying to leave the birth canal and leave through the vaginal canal. They have to be super flexible, and maybe you've noticed babies can, like, sit on the floor with their legs crossed and make their head touch the ground. I mean, that would really hurt me if I tried to do that. But they're just super flexible, and part of the reason is they're full of cartilage because their bones are not fully formed. Well, what's going to happen over time is that cartilage is going to become bone, and we would call that process of cartilage turning into bone, we would call that ossification. And this happens in multiple parts of the body. So, and it's different from calcification as well. Calcification would be taking that osteoid and making it hard by adding calcium minerals to it. Okay, so we already talked about it requires the transformation of one type of tissue into bone. And there's two different kinds. There's intramembranous and there's endochondrial, and we'll see some examples here on the next slides. Let's see. Okay, well, I guess before we do that, we're going to look at this endochondral growth. So this is, again, bone replacing cartilage. So if we look at a long bone like we have pictured here, for example, and you look at a kid, which we'll see on that x-ray that I flashed just a minute ago, there's a growth plate, and most of you have probably heard of growth plates and know that kids in particular have growth plates, and that's where growth occurs in their long bones. We learned earlier that's the physis, right? That's the part where bone growth is occurring, and the part above that was the epiphysis. The part surrounding that physis was the metaphysis, right? Well, once that bone growth stops, so once that ossification completes itself, you end up with kind of solidification of that physis, and you have what we call an epiphyseal line that forms. So the epiphyseal line is what used to be the physis, what used to be the growth plate. Once you're done growing and that plate closes and hardens and calcifies, becomes bone, then there's no more growth that can happen, and we call that line that you can see on the x-ray the epiphyseal line. We'll see that here on the next slide. So this is a picture of probably I don't know, a young adolescent, maybe a 12 or 13-year-old, and we're looking at the leg. So this is the femur here, and then we have the tibia here and the fibula here. And what you notice at the end of all of these bones, you notice this opening. You see that there, and there. You see another one here and here, right? So those long bones, they're not done growing yet. So that's the physis. That's the growth plate. That's where the bone is going to grow longer, is from that end and from the other end. Okay, but eventually that, once you're done growing, that ossification center becomes calcified itself, turns into bone, and then there's no more growth that happens. So if we look on this side, this is somebody who's done growing, maybe a 30-year-old, but you can kind of see the faint line, can't you, of where the physis used to be. It's kind of hard to see on the tibia, but you can definitely see it on that femur. So we would call that the epiphyseal line. So bone growth regulation is fairly complicated. We'll talk a little bit more about it in physiology. I just want to get you familiar with some of the minerals, vitamins, and hormones that are involved in bone growth regulation. And so they're listed here for you. The main mineral is calcium. We could also put phosphate there as well. That's also heavily involved with bone growth. The primary vitamin is D, but A and C are also involved. Calcitrol is a hormone secreted by the kidney that's involved. We'll spend a bit of time in physiology talking about parathyroid hormone. These guys they live on the back of the thyroid gland. There's 4 of them, and they're kind of the primary hormone for the regulation of bone growth. And they're tied to calcium levels in the blood. So if calcium levels in the blood are low, parathyroid hormone is released, which causes the breakdown of bone, which then releases calcium that used to be in the matrix of the bone that's now been dissolved. And then serum calcium levels, blood calcium levels, can rise again. And so parathyroid hormone is kind of the main one. Growth hormones involved, thyroid hormones involved, and some of the sex hormones are involved, which is why you have greater growth during puberty when those sex hormones begin to be produced in much greater numbers. So just be aware of the minerals, the vitamins, and some of these hormones. In physiology, we'll get more into the details. Excuse me. Bone repair and remodeling. We kind of mentioned this already, but there's a constant balance, right, between osteoblasts and osteoclasts, and if that balance shifts one way or another, you either get bone growth or you get bone loss. So if you're heavier on the osteoblastic activity, like you are during your teenage years, then you're going to get bone growth. And if you are heavy on the osteoclastic side, then you're actually going to get bone loss or weakening of the bones, or loss of some of your bone mass. And so it's kind of a balance. So for when you're not an adolescent and when you're not very old, so for most of your life, it's a balance between the two. So you might be having osteoblastic activity in one part of the bone, and then you're having osteoclastic activity in the other part of your bone. So just as an example for the picture here, let's say osteoblasts are putting down new bone, and then osteoclasts may be dissolving bone in another area, so that the net result is you get really no new bone mass because you're dissolving as much bone as you're laying down. When you're a child, an infant and a child and a young adult, however, you are laying down new bone, right? So here's what happens. Here's the problem, for example, with Edna that we saw at the beginning of the lecture, is that as we get older, and this is true for men and women, but much more true for women once they stop producing estrogen, that our osteoclastic activity begins to increase as we get older. Now, I don't mean older like 30 or 40. I mean older like 60, 70, 80. As we age, our osteoclastic activity increases, and our osteoblasts are not able to keep up with the osteoclasts that are breaking down bones. And this causes thinning of our bones, which leads to a disease called osteoporosis. Think of porosis like porous bones, bones that are holy, bones that are missing bone, right? Bone, and you can actually see a picture here. Here's normal spongy bone, and look here at the osteoporotic bone. I mean, you've got kind of pock marks all through here of where bone has been eaten away. You have porous bone, right? Osteoporosis. And that's because osteoclastic activity has increased. Now, just for your own curiosity and edification, the best way we have really to treat osteoporosis is a medicine called bisphosphonates. You don't have to memorize this for anything. This is just for your information. But the way that bisphosphonates work is that they bind to these crystals that are in the matrix of the bone, and they inhibit osteoclastic activity. So they shut down the osteoclasts so that you stop breaking down your bone. So this is the problem with Edna. If you were going to look at her, let's see if we can, not really. Let me use the blue. Try to ignore the red if you can. I'm not sure why that's there. And just look at this vertebrae. You see how that's kind of a rectangle, and see the one below it, and see the one below it. And you see how they're more or less the same size, right? And look at this one here. Now, as you go up, they get a little bit smaller. That's normal. But look at what has happened to this vertebrae here. It kind of looks like this, right? Like it's been smushed, right? It should be like that. So this part has been smushed down, and we call that a compression fracture. And this is a sign, especially if there's no trauma, this is pretty much diagnostic of osteoporosis. There's very other few things that can cause this kind of fracture if there wasn't trauma involved. And so poor Edna, the reason she's having back pain is she probably sneezed so hard and her bones were so weak from osteoporosis that when she sneezed, that bone crumbled underneath the force of her sneeze and it caused a compression fracture. And that's why she's having pain. So now we're going to transition a little bit into kind of characteristics of different types of bones. And we're going to start by looking at different bone shapes. And because our bones have different shapes, we have organized them into different groups based on those shapes. And we'll kind of look at each one of these individual 7 shapes here on the next slides. So there are some bones that we call flat bones. Excuse me. So these are bones that are relatively thin. They have basically parallel surfaces of compact bones, meaning the front and the back, for example, will pretty much have a compact bone that's parallel to each other. And you can kind of see if we blow up the picture, you've got compact bone here and compact bone here, right? And then you've got kind of some spongy bone in between. And the kind of the classic example for that is the skull bones. So you see here the parietal bone, that's one of the bones of the skull. And so that's kind of the representative bone for flat bones. Sutural bones, these aren't, quite honestly, these aren't very important. And I don't care that you learn too much of them. I guess just be aware that there is such a thing. When we look at the bones of the skull, we're going to see where those bones come together. So your skull is made up of multiple bones. And when you're a baby, you have a soft spot. Those bones haven't completely come together yet. When they do come together, sometimes there's a new bone that forms at the intersection of 2 other bones, something called the suture. So you see here, like for example, this bone is attaching to this bone and this bone. And the attachment sites here are called sutures. This is where the bones come together. Well, occasionally you get another bone that grows right in that suture, and we call that a sutural bone, but it's really not clinically important. Okay, pneumatized bone, the kind of classic example there is that, skipped on me, is the ethmoid bone. This is a bone that sits right between your eyes, kind of pushed back into the skull. And pneumatized, the word pneumo comes from the Greek word which means wind or air. And so it's the part of the bone, it's a type of bone that has holes in it where air is often trapped. So that's why we call it pneumatized. So you can see if you cut through that little piece of bone, you would see these air cells in that bone, and that's where the term pneumatized bone comes from. There's only a couple pneumatized bones in the body, and we'll point them out as we learn them in the next lectures. Ethmoid bone. Oops. Sorry. Long bones, we've already talked about the anatomy of a long bone. These are all long bones. Your humerus, for example, these 2 bones of your forearm, the ulna and the radius, those are long bones. The femur is a long bone, the tibia and the fibula are long bones. So I was mentioning the bones of your limbs, and we've already kind of talked a bit about long bones. Sesamoid bones, now these are interesting. These are bones that grow up kind of in the midst of a tendon or a ligament, and they're not actually kind of attached to another bone. So sometimes people call sesamoid bones, they call them floating bones because they look like they're just floating all by themselves. Now there has to be something that's keeping them attached to the body. The primary sesamoid bone in the body is the patella or your kneecap. But there are some other sesamoid bones you sometimes find in the wrist and in the foot as well, these kind of floating bones. Short bones, these are the bones of the hand and feet. There's a bunch of them there in the hand, and there's a bunch of them also here in the feet. Carpal bones and tarsal bones, and we'll meet them in more detail in future lectures. Irregular bones, so these are bones that basically don't fit any other category, so they had to come up with a a name for them. And the vertebrae are the classic example of irregular bones. There are also multiple names that you're going to have to learn as you start here. Really, in the next lecture, we're going to start basically memorizing body parts. And as you start memorizing body parts, you're going to start seeing recurring words. You're going to see words that come up over and over in different parts of the body, and they're going to be named maybe slightly different, but you're going to see these common words. And so we're going to go through some of the common reoccurring words and what they mean, and hopefully that will help you when you sit down to memorize different parts. We're going to do the skull and the facial bones here first, and a lot of these show up there, but as we get to the rest of the bones, you'll see a lot of these terms showing up in multiple places. So if we look over here, we can see that a process is kind of any projection or bump. So we're going to look at something, for example, called the zygomatic process. It just means it's a projection. It's something that kind of comes out of the bone, comes out of the main bone. A ramus is similar. It's an extension of the bone that forms an angle. So that's kind of the difference there between the process and the ramus, is this formation of an angle. So this is your mandible, and then all of a sudden you can see it changes its angle. So we call this the ramus of the mandible. It's the extension of the bone that forms an angle. If we move over to this picture, most of you have heard of your sinuses. These are typically fluid-filled holes or chambers, sometimes filled with air, sometimes filled with mucus. A meatus or a canal, you're going to see this in a few different parts. Just basically means a passageway. And quite honestly, foramen and meatus are almost used interchangeably. Technically, foramen is supposed to be more rounded. That's kind of the main difference between foramen and meatus. But you can remember basically both of them as a passageway for nerves or arteries to pass, kind of like a tunnel. A fissure is going to be more like a slit or a deep furrow. So you're going to see several examples of fissures. The one here shows you this fissure in the orbit. You can see it on both sides there. More bone markings. A sulcus, for example, is going to be kind of a groove, a narrow groove, and what you might find is a tendon runs through that groove, or a nerve or an artery runs through that groove, and so we often give it a name just because it's something that's visible. A fossa is going to be a shallow depression. So here's a great example of a fossa over here. See that there? And this fossa in here, this is where the head of the femur is going to go. So fossas are basically shallow depressions that often articulate with another bone. They often become the joint with another bone. If we look at the word trochanter, the greatest example, best example is here on the femur. There's a greater trochanter and there's a lesser trochanter. So these are large, rough projections. A crest is kind of a prominent ridge. A spine is more pokey, more pointy. I don't know if we can see the spine here on the pelvis. These are spines here. These are ischial spines. They're kind of pointy projections. The key is they're more pointed. than say a trochanter. A trochanter tends to be a little bit more rounded and a little bit more rough. Tubercle is kind of like a small trochanter, and as is tuberosity. You'll start finding out that some of these terms tend to run into each other. Um, but I always remember tubercle as kind of a small trochanter. And a tuberosity is more, it's less rounded, so the tubercle is more rounded, and a tuberosity can be really any kind of small projection on a bone. Okay, we talked about a lot of the parts of a long bone already. Something we didn't talk about that a lot of them will have is a neck, which is a region of the bone that connects the head to the shaft. A facet, that's another important word. Facet basically means an articulating surface. It means where a joint is going to take place. So it's usually a kind of a flat area where one bone is going to form a joint with another bone. When one bone forms a joint with another bone, we call that articulating. So the bones are articulating with one another. So that's where that term articular surface comes from. Okay, we're going to talk about fractures a bit in lab, so we'll go ahead, skip through that part, and we'll save this for our lab discussion.